Hello, my name's Megan and I'm going to be your student nurse. Today I'm going to teach you about an anti-diabetic drug called Metformin. When you eat sugar-dense foods, they are broken down by digestive enzymes from your mouth all the way to your stomach. As they leave the stomach and enter the small intestine, your pancreas, in pink, then releases a substance called insulin. Insulin binds the sugars and, like a chaperone, brings the sugars into your muscles for fuel. Both the sugar and insulin travel through the bloodstream, raising blood sugar levels. Your liver, in red, collects some of that sugar for later, to release in between meals to maintain a healthy blood sugar level. What's not collected remains in your blood to feed your hungry muscles. But in order to get to your muscles, the sugar needs to have the chaperone insulin to get them through. And to get through, they need to get past those receptors, which are kind of like bouncers. Normally, the bouncers have a good memory and recognize the insulin and let the pair in. As the sugar enters the cell, leaving the red carpet, the blood sugars naturally lower. Now, when people consume a lot of sugary foods over a long period of time, the pancreas has to produce a lot of insulin and it has a hard time keeping up. As you can see down here, all the pink sugars are waiting to get in, but there's not enough chaperones to let them in. Over time, the bouncers become lazy and forget their buddy insulin. Type 2 diabetes develops as more and more sugar starts accumulating in the blood. Common signs of high blood sugar are fruity smelling breath, puking, stomach pain, fast but weak pulse, high blood pressure, really thirsty, tired, weak, weight gain, having to pee a lot. If untreated, constant high blood sugar can cause blindness, loss of feeling in hands or feet, increased chance of heart attacks, strokes, or even coma. Metformin, with a change of lifestyle, lowers blood sugar by limiting how much of the stored glucose is being released back into the blood from the liver. The medication also wakes up those lazy bouncers into recognizing insulin again. Because metformin does not contain insulin or affect insulin production, it is not intended for type 1 diabetes. Metformin tablets are to be taken with meals. Half the medication will still be in your blood by 6 hours. As you can see, I've also illustrated the times that metformin works the hardest in your system based on if you're on extended slow-release tablets or regular tablets. If taking extended release tablets, do not chew, as this can make the medication not last as long as it should. Side effects of metformin can be lack of energy, headaches, dizziness, chills, feeling lightheaded, tight or painful chest, heart rate that increases randomly, high blood pressure, runny or stuffy nose, diarrhea, nausea, vomiting, feeling bloated and gassy, losing interest in food. Food might start to taste different, constipation, tummy trouble, weight loss, lower than normal blood sugar, muscle aches, respiratory infections, blushing, nail issues, sweating a lot, and infection. The nurse should thoroughly assess patients for any problems with their kidneys or liver before giving any patient metformin, because the medication affects the liver function and is filtered out by the kidneys. Use metformin with caution in the elderly and people with unbalanced diets, because they can increase the risk of dangerously low blood sugar and the chance of blood becoming too acidic. Constantly monitor sugar levels are between 4 and 8, the sweet spot being around 6. If the patient is under severe stress, insulin may be needed to keep the blood sugar in that sweet spot. Monitor the amount of water taken in and out by the body, ensuring the body is well hydrated and the medication is being removed. Assess patients for the possible pregnancies or if they're breastfeeding. Metformin has been found to show up in breast milk and can cause the baby to have a dangerously low blood sugar. Advise the mother to either stop taking the medication or stop breastfeeding. Assess current birth control medications, because some can cause the blood sugar levels to elevate while on metformin. Test the patient's blood calcium levels and B12 levels before starting metformin. Always check blood sugar levels before and after giving medications. Explain to the patients the importance of self-care, following a prescribed diet, and exercising. Thank you.